So, welcome everyone to Not an Experiment 101. This is part one of a two-part webinar series that aims to highlight the health promotion initiative, Not an Experiment. I'm Adam, and I work as a public health nurse in the smoke-free program at the Simcoe Muskoka District Health Unit.
And my name is Claire, and I am also a public health nurse in the smoke-free program at the Simcoe Muskoka District Health Unit. Together, we are representing the provincial Not an Experiment Communication Work Group to provide you with this webinar today. We will now begin with our land acknowledgement. The Simcoe Muskoka District Health Unit covers a large geographical area extending from Bradford up to the town of Huntsville. This is the area where we live and work. We would like to acknowledge that the land that we are gathered on today is the traditional territory of the Anishinaabe Nation, specifically the Chippewa Tri-Council, comprised of the Chippewas of Beausoleil, Rama, and Georgina Island First Nations. We also acknowledge the Potawatomi of Moose Deer Point, the Mohawks of Wata, and the Georgian Bay, Moon River, and Barrie South Simcoe Métis councils in this region. The Huron-Wendat and the Haudenosaunee Confederacy have also walked on this territory over time. Ontario is covered by 46 treaties and other agreements and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements, including the One Dish with One Spoon Wampum Belt Covenant, are agreements to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. Most of us have come here as settlers, immigrants, or newcomers in this generation or in generations past. We are all treaty people. So over our time this morning, we will cover many different things. What Not an Experiment is, including how it started and why it is relevant now, all of the different resources that you as public health workers, educators, and adult champions can use to support the youth in your area, how to use a comprehensive approach to make the most significant impact when implementing Not an Experiment, the program's evaluation activities, and a high level of results so far, and of course, a sneak peek into part 2 of this webinar series. But just before we begin, we would like to know how familiar you are with Not an Experiment, or as we will refer to many times in the webinar as the acronym NAE. Kathy, can you please pull up the poll number 1? So our first poll asks members, how familiar are you with the Not an Experiment initiative? And we will keep this up for about 15 seconds. And the answers are, I have heard about it, but don't know much about it. I've seen some of the different components. I am familiar with all components, or I am familiar with all components and have experience implementing NAE. So if everybody could just click the poll, and we'll keep this open for 15 seconds. Perfect. So we do have another question to ask the group. And so this is poll number 2. Kathy, if you're able to pull it up. So the next question asks about confidence. So for those who are familiar with this initiative, how confident are you in implementing Not an Experiment? And the answers are, I am not confident at all, I am somewhat confident, or I'm confident. And again, we'll keep this up for about 15 seconds. Perfect. Thank you so much, everyone. We appreciate your input and hope that by the end of the webinar, you will have all of the knowledge and the confidence to implement Not an Experiment. So without further ado, we give you Not an Experiment, which is a free web-based health promotion initiative that aims to teach youth in grades 7 to 12 about vaping and help prevent them from experimenting with and becoming addicted to e-cigarettes. Vaping is relatively new, and many students, parents, guardians, and teachers just don't know a lot about it. The best way to learn information is to hear this multiple times in various ways from multiple sources. And so that is why Not an Experiment is centered around building capacity among adult champions. Nonexperiment.ca is the home to several resources and downloadable materials that were created to support public health and community partners in educating youth about the risks of vaping, nicotine addiction, industry marketing tactics, and so much more. But to really understand where we are now, we should start with how this all started. So let's step back to 2018, the year that e-cigarettes became legal to sell to adults, and just 4 years after e-cigarettes were first introduced to the Canadian market. During this time, Central East TCAN member health units reported an overwhelming need for interventions and resources to respond to school and community requests related to youth vaping. In response, the Central East TCAN commissioned the Ontario Tobacco Research Unit to conduct a literature review exploring vaping interventions and to highlight best or promising practices. This review, which included a scan of public health unit activities, returned limited interventions, and in most cases, there was insufficient evidence to assess the effectiveness. So, as a result, the Central East TCAN committed to developing an Ontario-based intervention to prevent the initiation and escalation of vaping among youth in grades 7 to grade 12. So you may wonder, why start at grade 7 and not earlier? This target audience is based on available Ontario data, which supports that grade 7 is a very appropriate time for primary prevention of vaping, as the vast majority of youth in this age group do not vape. We see that the prevalence of youth vaping really begins to increase after grade 8. During the development of this health promotion program, it was recognized that the evidence around effective approaches to prevent youth vaping was and still is emerging. And as such, the development of Not an Experiment was informed by many things. One of them was best practices from youth smoking prevention. There was also youth engagement, with both messaging and health promotion activities being informed by and piloted with youth at every stage of the process, and input from adult stakeholders, which includes educators, parents, public health colleagues regarding local needs provincially. And with this began the launch of Not an Experiment. So you may wonder, are youth a target? Why is it so important to educate youth about vaping? Since entering the market in mid-2000, e-cigarette use has grown at an explosive rate, especially among non-smokers and youth. According to the 2022 Canadian Tobacco and Nicotine Survey, 30% of Canadian youth aged 15 to 19 report having tried vaping. But you may wonder, why are so many youth interested in vaping? Are they using vaping as a tool to quit smoking? The stats tell us that the youth in this age group, 15 to 19, who have used a vape in the past 30 days, did so to reduce stress, for curiosity, and because they enjoyed it. Only 5.7% of these youth reported that they vape for smoking cessation purposes. The rates of youth who vape but have never smoked continues to grow, and we continue to face the challenge that youth hear that vaping is less harmful than smoking, but don't recognize that vaping is not harm-free. We need to reach our youth and provide them with the whole picture, not just what the industry wants them to see. Together, we can support our youth to live a nicotine-free life, and here's how.
Thanks, Claire. Since launching in 2019, Not an Experiment has housed all of its resources on its central hub, notanexperiment.ca. The website's easy navigation, interactive design, and up-to-date information make it a one-stop shop to collect the information and resources you need to educate yourself, other adult champions, and youth about vaping. But don't take our word for it. Let's dive in and take a closer look. Welcome to notanexperiment.ca. This site's design and functionality was built with youth in mind, and it features 9 different pages to explore. Today, we will talk about some and dive into others. However, we recommend everyone take some time on their own to explore and familiarize themselves with the site. First up is the home page. This page introduces the user to the basics, answers questions like, what are vapes? What's the process of vaping? From activating the vape to exhaling. How safe is it? As well as exploring common ingredients in e-cigarettes, and how to spot the signs that someone's vaping. The industry. Are youth a target? The industry page takes a closer look into the relationship between the tobacco and vape industries and what their primary objective is. Spoiler alert, it's not the health and well-being of our youth. Next up, the health effects page, which focuses on the health effects of vaping, the difference between cigarettes and e-cigarettes, as well as nicotine addiction and nicotine poisoning. And added just this year are the mental health and resist pages. Some people think that vaping helps get rid of stress, anxiety, and depression, but it doesn't. The mental health page includes information on how the cycle of nicotine addiction can cause stress on the brain and body, and provides healthy suggestions on ways to cope instead of reaching for a vape. We know that the majority of youth who vape are getting their products from social sources. That's why learning to resist the pressures to vape is so important. The resist page explores where these pressures can come from. For example, social media influencers, friends, and family, different ways we can get pressured, and different strategies to avoid pressures like refusing, delaying giving an answer, or suggesting or agreeing to do something else. And though we strive to lessen the amount of youth who ever try vaping, we also want to help any youth who want to quit. According to the 2022 Canadian Tobacco and Nicotine Survey, 59.9% of daily vapers aged 15 to 19 made at least one quit attempt in the past 12 months. Cue the quit page. This page is equipped with a fillable quit plan that can be sent directly to the user's email inbox. The plan explores the user's reasons for quitting and helps identify possible triggers and how to cope with them. There are also QR codes that lead to 2 vaping cessation apps geared towards youth, Quash and the Stop Vaping Challenge. Next up is the educator page. This page contains all the resources an educator would need to implement Not an Experiment in a comprehensive way. whether it's preventing vaping in school washrooms by using the resources like posters, announcements, or the Take the Clouds Outside activity, which teaches youth about harms of secondhand vapor and makes sure that they're aware of the fines for vaping on school property. On this page, educators have access to the escape room activity, both the online version and the in-person version. These activities allow students to solve challenges and puzzles to learn about the health effects of vaping, how the industry targets youth, and nicotine addiction. Here, the educators will also have access to the facilitator instructions, as well as the answer key. Educators can also find on this page grade 7 and 8 lesson plans, equipped with 3 different activities. As well as refusal skill resources. To add to the comprehensive approach, schools can implement some of these other resources, including reading announcements, and putting up posters and postcards. And for educators and other adult champions who just want to learn a little bit more about vaping, there's a PowerPoint so that they can feel more comfortable when answering questions from youth. And last but certainly not least is the parents page, where users will find a series of videos aimed at encouraging parents to talk to their kids about vaping. They listen more than you may think. These videos focus on the topics of the health effects, addiction, social influence, the industry, and how to help your child if they are vaping. The page includes an easy to download print or download resource sheet that highlights how parents can get the conversation started. We hope that you all take advantage of all that Not an Experiment has to offer. If you ever have any questions, you can reach out to Not an Experiment at smdhu.org or simply fill out the Contact Us section located at the bottom of the homepage. All right, now that we all have a better understanding of what an experiment has to offer, let's talk implementation. The problem of youth vaping is complex, and the first step to changing people's behavior is to raise awareness of the issues and to provide tools so individuals can make an informed choice. Using a comprehensive approach ensures that our youth, educators, parents, and caregivers are exposed to the messaging several times in several different ways, increasing the likelihood of them understanding and remembering the information. But what does a comprehensive approach look like? Let's see an example of how a school can implement Not an Experiment. ABC Secondary School has been having issues with students vaping on school property and has received complaints about students vaping in the washrooms. Understanding that nicotine addiction is a complex issue, The school administrators plan a week-long school-wide blitz to ensure all students, staff, parents, and caregivers receive health education related to vaping. Before the blitz starts, staff are encouraged to visit notanexperiment.ca to familiarize themselves with available resources. Reviewing the website will give them a better understanding of vaping, how to support their students in resisting the pressures to vape, and where they can find support to quit. They begin the blitz by placing vaping prevention and cessation posters around the school and Ontario law postcards on lockers. Putting messages front and center ensures students are aware of the laws around vaping on school property and the associated fines, as well as providing them with a way to access quit support. The next step is sending out the talking resource to parents and caregivers to help them support them in starting the conversation about vaping with their kids. During the week, they read daily announcements to increase exposure to health messaging and set up the Take the Clouds Outside activity, which supports Smoke Free Ontario Act compliance, educates about secondhand vapor, supports quit attempts, and assists with reducing social exposure to vaping. The school completes their week-long blitz with classes completing either the in-person or online Escape the Experiment activity to learn more about the health effects of vaping, nicotine addiction, flavors, and the industry tactics so students can make informed decisions about their health. As previously mentioned, providing the messaging several different ways and at different times is key. Now, let's take a look at how an elementary school might implement not an experiment. 123 Elementary wants to take action to prevent its students from vaping. Throughout the last few months, teachers have had many students asking questions about vaping. Students say they hear about it on social media and from other older siblings and are just curious to know more. Like the previous school, 123 Elementary understands that the best approach involves educating not only the students, but the staff, parents, and caregivers as well. They take many of the same steps with a focus on prevention. Before the week-long blitz, staff visit nonexperiment.ca to familiarize themselves with available resources and vaping information to gain a better understanding of vaping so that they can feel more comfortable when answering these questions from their students. And just like the secondary school, they put up posters, send out the talking resource to parents and caregivers, and read daily announcements. The most significant difference between the secondary and elementary schools is the use of the grade 7 and 8 lesson plans. Participating classes begin the week with Lesson 1, where students learn how to compare personal knowledge and experience with vaping to new information and develop a new understanding of current issues with vaping. During this lesson, the students complete the escape room activity, solving challenges and puzzles to learn about the health effects of vaping and how the industry targets youth and nicotine addiction. A couple of days later, the class moves on to Lesson 2, where students learn about the purpose of media and advertising and how advertisers profile and market products to specific audiences. The week finishes with Lesson 3, teaching students how to use the inquiry process to investigate issues related to vaping. For their last task, students create an infographic using appropriate forms and techniques to convey a message to their intended audience. After the week is complete, all the members of the school community are more knowledgeable about vaping and have a better understanding of nicotine addiction and the industry, better preparing them for questions or exposure to vaping in the future. Shortly after completing the Not an Experiments initiative, ABC Secondary and 123 Elementary both provide feedback on their experience by emailing notanexperiment@smdhu.org. ABC Secondary is happy to report that they have seen a decrease in vaping on school property, and both schools say that staff are now more confident speaking about vaping and that students have a greater understanding of the potential consequences of vaping. Amazing. We are glad to hear another two schools have made vaping education a priority and have seen success. Both schools are now better equipped to provide vaping education to their staff and students in the future. Hearing feedback is essential. It helps us measure the success of not an experiment. We want to know its strengths and any weaknesses so that we can fill any gaps and best reach our youth and those adult champions who support them.
But just as feedback is so essential, so are the results from evaluations. These results are used to determine the impact of not an experiment and to guide future planning. That is why an electronic survey was developed to collect information about the reach of the not an experiment program so far across Ontario. The Reach Tracker results show that between January to June of this year, 17,829 youth in grades 7 to 12 were reached with not an experiment. There were 236 not an experiment events reported, and 21 public health units reported implementing NAE. This is 61% of health units in the province. In addition to the Reach Tracker, the online computer game on the website collects self-reported feedback from players when they reach the end of the game. The data reveals that, on average, over 90% of players either agree or strongly agree that after completing the game, they have a better understanding of the harmful effects of vaping, have a good reason not to try or to continue vaping, and are more aware of how the tobacco industry makes kids want to try vaping. As we look into future planning, the Simcoe Muskoka District Health Unit, with the support of public health units across Ontario, has engaged an external research consulting company called PRET Solutions to conduct a provincial evaluation and look at the extent to which NAE is achieving its intended objectives. This comprehensive evaluation is currently taking place and will continue into next year. So, if you work in a public health setting and are interested in supporting and participating in this program evaluation, please connect with PRET Solutions. We will provide the contact email address in the follow-up email from this webinar for those who are interested. So as we wrap up today's webinar, we would like to reassess your confidence level in implementing the non-experiment initiative. So we do have a third poll. Kathy, can you please pull up poll number 3? And our last poll question is, after attending this webinar, how confident are you in implementing the non-experiment initiative? And the answers are, I am not confident at all, I am somewhat confident, I'm confident, or I'm very confident. And we will keep this up for 15 seconds. Perfect. Thank you very much for your input. As mentioned at the beginning, this presentation is part 1 of a 2-part webinar series. The second webinar will be held at the end of March of next year. It will cover topics such as exploring different approaches to implementing NAE in a variety of settings, connecting with schools and community partners, and how to overcome barriers. But we also want to hear what you would like to learn about for part 2. Please comment in the chat, or you can email Adam and I with your suggestions. Our email addresses will be provided in the follow-up email as well, which will be sent in the next couple of days.
And with that, that brings us to the end of our presentation. We want to thank you all for your attention and are now going to enter the question answer period of the webinar. So if you do have any questions at all, please place them into the chat. And if by chance we run out of time and are unable to answer all of the questions, we will collect and respond to them in our follow-up email.
Okay, so looking at the chat, One of the questions was, do you have a step-by-step guide to implement a 1-week NAE blitz for elementary and secondary schools? The example was great. There's not a step-by-step guide, but there are several resources on the website. And we can, the recording will be available after. We can always look into this a bit more and create something that if this would be useful for the group and for provincial partners as well. And we will have a recorded version. So it will be posted on the Central East TCAN YouTube page in the next few days. And we can send in the follow-up email, we'll let you know where that location is. The next question, can organizations use NAE resources on their social media without notifying SNDHU? Tracy, do you have an answer for that one?
I believe they could.
Yeah, we don't really have a huge amount of, we want Not Experiment to be out there. We want as many people using it as possible. So it's always good to know how people are using it, using our provincial reach tracker. So we would appreciate if people were to let us know via the reach tracker if they are using it on social media, but definitely things are available for use and for sharing as widely as possible.
And the next question, how receptive are youth to the refusal skill resources? So that's a good question. And hopefully we'll be learning more about that. So these resources have just been uploaded to the website. So we will be reviewing how they are doing and collecting feedback from teachers and other adult champions.
And the next question, will there be more information for those younger than grade 7? I realize grade 7 and older are the target group, but youths are getting younger. And we want to prevent them from using. So non-experiment, as mentioned before, is based on the evidence in Ontario. So if the evidence changes, non-experiment always adapts to new data and it is updated quite frequently. So we will just look and adapt accordingly.
Claire, I'll add to there that obviously all of the information is available on the website. So if there are teachers out there and schools out there that think that they could use and adapt the information that's on there for a younger grade, that is totally up to them and they're free to do. But as you said, we do want to respond where the research and the data tells us to. And as you indicated, right now that's grade 7 and 8, but 100% we're trying to keep our eye on that as best we can, and we'll definitely pivot if the research and data tells us we need to.
Perfect.
And then Ruth asks, could a future webinar include the public health unit staff member who's implemented NAE in schools, talk about their experiences, example, what worked, what didn't work? Exactly. So that's something we're definitely going to be putting into part 2. To have a case study like that would definitely be helpful. So thank you for that, Ruth. And where is the reach tracker was asked. We can definitely send a link in our follow-up email to the reach tracker for you all to use. Yes, so the next question was, can we access the slide deck presentation separately from the webinar recording? And yes, we can make sure that this is available probably through SharePoint. And then if you don't have access to SharePoint, you can contact Claire or I directly. I think this is Cindy just saying that we will continue to check with Public Health Ontario about the appropriate prevention target group and take their advice on age. NAE will be adapted if needed.
And hi, it's Cindy, Adam. I just wanted to mention it isn't live yet, I don't think, but OTRU has been developing some high school age curriculum and will be on the Stop Vaping Challenge website. But as I've checked, I haven't found it live yet.
No.
Thank you, Cindy.
I think that's about all that I see in the chat. Again, if you do have any questions, my email as well as Adam's will be in the follow-up email, and you can message us your questions that way. I think that's it for the questions, Adam. So thank you so much for joining us all today. We hope that you enjoyed the presentation, and please look forward to the part 2 of the webinar. Again, we want to hear your feedback and your suggestions for part 2. So we welcome those suggestions as well.
Thank you very much, everybody. Thank you for attending today and your time. Appreciate it. Oh, we do have one hand. No.
Are we ready to stop the recording?
Oh, yes.
I think so, yeah.